Please stand with us for the pledge and prayer. Gentlemen, please remove your hats. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. Dear Heavenly Father, we thank you for the opportunity to come together to do the work of the citizens of this great county that we live in. We would ask that you could possibly give us some relief from these torturous cold weather that we've had. We know that you will, and we know that there's light at the end of the tunnel with that, Lord. We just know that you're going to make it warmer soon. We know that. That's the hope that we have. I ask that you watch over us, guide our decisions, help us each and every day with our decisions, help this board to make good decisions. I ask that you be with Washington, D.C. They once again are having their issues with shutting their government down and not necessarily always working what's best for the people of this country. And we just ask that somehow, some way, you could help them, Lord, and be with them. Be with our state legislature right now as they're in session and guide their thoughts and actions as well. And we ask all of this in your Son's name. Amen.
Amen. Okay, thank you for attending the commissioners' meeting this evening. We appreciate everybody being here. Do we have any special announcements or recognitions?
We'll do so.
Okay, we have the approval of previous meeting minutes.
So moved.
Second.
I have a motion and a second. All in favor?
Aye.
Those minutes are approved. I'll get these signed. We have a lot to go through this evening, so bear with us. That takes us to departmental business and reports. First up is our planning commissioner, Mr. Sheeline.
Good evening. I have 4 items on the agenda. I have 2 rezonings and 2 one-lot subdivisions. The rezonings are, the first one is ordinance 2026 BCCO-05. This is rezoning a property at 906 South 950 West from agricultural to rural residential. I was not able to attend that meeting, but one of my planners was, and she said there was no remonstrance on any of these 4 cases.
And she did a fine job representing your department.
I thought she would, yes. Thank you.
Okay, any questions for Mr. Sheeline?
No.
We have a motion.
Make a motion to accept ordinance 2026 BCC 05.
Second.
I have a motion and a second to accept ordinance number 2026 BCCO-05. All in favor?
Aye.
Okay, that ordinance is approved.
The second case I have is ordinance 2026 BCCO-06. Again, this is a rezoning for 11990 West 350 North, and it is from agricultural to rural residential as well.
Any questions for Mr. Sheeline?
Nope. Make a motion to approve 2026 BCCO-06.
Second.
I have a motion and a second to approve ordinance number 2026 BCCO-06. All those in favor?
Aye.
That ordinance is approved.
And I have 2 one-lot subdivisions that go with the rezonings that we just passed. The first one is at 906 South 950 West. This is Merrill Ridge subdivision, and it's for a one-lot subdivision.
Any questions for Mr. Sheeline?
No, sir.
Make the motion as read.
Second.
I have a motion and a second. All in favor?
Aye.
That is approved.
Thank you. Last case I have is 11990 West 350 North. It's Ashenfelter subdivision, Section 3, and it is also a one-lot subdivision.
Motion to approve.
Second.
All in favor?
Aye.
That is approved.
Mr.
All I have.
Sheehan, can
Thank
I
you.
ask you one question right
Sure.
up there? Could you make the citizens aware of, we're potentially going to have a code enforcement for the county? Can you speak
Yes,
to that real
yes.
quickly?
Actually, Pam and I are working with Harold Clark. He is our potential new compliance officer. We're working to get a meeting set up with him next week to finalize everything. I think everything else is in order, and I would like to see him get started by mid-February so we can start looking at some of these properties.
Thank you.
Thank you.
Yeah, we're working on getting that started just as soon as we can, so we're very close. Okay, that takes us to Howard Haven. Jennifer?
There. I have two applications to get approved today. I have Julia Christakis and Lisa Lovejoy, who would like to be approved to reside at Howard Haven.
Pulling those out now, Jennifer. Do we have any questions for Jennifer?
Nope. Jeff wanted to type ship out there.
If we accept both these, is that, are you full?
It's 20, yes, and then we're going to do one transition room, possibly 21, so yes.
I would move to approve.
Second.
And a motion and a second. All in favor?
Aye.
This is-
Yeah, those are your copies.
Do we need something up here?
That's if they're the responsible party,
Okay.
but the resident is, so you are exactly right. There you go.
Stratus.
One more, I think. Sure. There you go.
Thank you so
Thanks.
much.
Thanks, Jennifer.
Thank you.
Thank you, Jennifer. That will now take us to the Highway Department. Amber Toll.
My first item is for an LPA consultant contract approval. This contract is for our bridge inspection contract. It's a federally required four-year contract to inspect all of our bridges. This one will go from 2026 through 2029. And we went through the federal process to choose our consultant, and we have gone with USI Consultants at a contract not to exceed $432,031.51. So I would like to request that we approve that contract and move forward.
Questions for Amber?
No.
No, sir.
Do we have a motion?
Motion to approve.
Second.
I have a motion and a second to approve the contract for the bridge inspections. All in favor?
Aye.
Okay.
Okay, that contract is approved.
I just need signatures from everybody and then also Jessica too.
On this one or this one?
This one. Well, I mean, I guess either one, but that's a clean copy.
There you go.
And I do have a second item, if it's okay to
Alan,
present.
forgot to ask. You had looked at this.
Yes. While we're waiting, Amber, I just appreciate the work that you and your crew did. That cold weather and this amount of snow we got, you guys really did a nice job. And I appreciate the text keeping us informed on the road conditions and
Yes.
with the weather. It was pretty informative, so thank you.
You're welcome.
Jessica, is this the same contract that you had in our packet?
Yeah.
It is? Okay. All right. That was very helpful, all the information being exchanged throughout the week. And I don't know if people understand that when we look at the travel advisories, how many people we get involved in that. You know, we talk to the sheriff's department, we talk to your department, we talk to EMA, we talk to the city, the mayor's involved in that. Of course, the three of us are involved in that. So before decisions are made, all those people, you know, are on the, we're texting back and forth and getting information. We look at the weather forecast, so that's a joint effort. We sure appreciate all those people being involved. And sometimes it's early in the morning, sometimes it's late at night, but, so thank you. I echo what Jeff said about your department, EMA and the sheriff's department, city street department, and everybody being involved. So thank you very much.
You're very welcome.
So,
I do have a second item. I can present now or I can back. Is it okay?
No, it's fine.
Okay. So I do have a change order number 6 for our Bridge 56 project. This was the bridge that on 300 East, just south of Sycamore, that we've completed. We're just trying to tie up paperwork and all that good stuff. So this is change order number 6 in the amount of $2,798.40. And this is for a quality adjustment for our asphalt. So essentially, our contractor did all the NDOT testing that was required, and the results got them a pay factor of $2,798.40. So it's just a little bonus for them because their quality of asphalt was superior, so.
we appreciate getting the higher quality asphalt.
Yeah, yeah. And this is, typically, we don't have these on bridges because we don't have enough asphalt to even qualify for this program. But on this particular bridge, we did have a lot of tie-ins, so we had enough asphalt to like go for this program. So they had their testing done and they had good stuff, so they get a little bonus.
Move to approve.
Second.
I have a motion and a second. All in favor?
Aye.
That's approved.
Okay?
Thanks, Amber.
This just requires one signature.
Yep.
So since this does require one signature, I'll ask the commissioners to give me approval to sign this change order.
So moved.
Second.
I have a motion and a second. All in favor?
Aye.
Thank you, gentlemen.
Thank you.
Thank you.
Okay. Moving right along. Next up is our information systems, Jeremy Stevens,
There.
coming from around the corner.
He's hiding back there.
Good evening. I'm here tonight to request authorization to purchase servers from the Cumulative Capital Fund equipment account. This is for servers that we, refresh every 5 years. This is time to do it. Typically, last iteration, we had a 5-year lease, and so we had kind of flat cost every year. This year, we didn't get that 0% lease, and so to save on financing, I went to the council, requested an additional appropriation to pay it all up front this year versus spreading the cost out over the 5 years. So they granted that request, and so I'm here because the purchase is above the $5,000 and needs the commissioner's blessing. So I'm here to ask the commissioner's blessing to go ahead and make that purchase.
We appreciate the council doing that appropriations so that can be done, so. Questions for Jeremy?
Yep.
Make the motion to approve his request.
Second.
I have a motion and a second. All in favor?
Aye.
The request is approved, Jeremy.
Thank you.
Very much for
Thank you,
taking
Jeremy.
care of That takes care of all the departmental, takes us into new business. That takes us to Dr. Carrie Coco. For County Mental Health.
Good evening, Commissioners. I am here this evening to request your consideration of a motion and approval to recommend 4C Health as the next Community Mental Health Center designation for Howard County. That is a designation that goes to the Division of Mental Health and Addictions. I'm going to talk a little bit about kind of the background to this and some key aspects of it, but I do want to give just a moment to Lisa Willis-Gidley to speak, because Lisa literally has been with 4C from 2015 when we first opened here in 4C, and has been a driver of what we've done here. And so I really feel like it's an appropriate time to give her an opportunity. And hopefully she's not going to cry in the midst of talking either, but go right ahead, Lisa.
Thank you. Good evening. When I was given the opportunity to become director in Howard County, we began with one school-based contract, and I had one community-based provider. We also had 2 or 3 therapists that were serving in the community. Today, we're contracted with every school corporation with the exception of one, and Howard County now has access to 50 therapists for the community. Carrie's going to share more data to illustrate our growth, but I've spent countless hours at the table with partners such as DCS, Kinsey Youth Center, other school corporations, probation, juvenile probation, local colleges and universities, and community stakeholders. I listened to the needs of the community, to the crises that were unfolding, and the clear gaps in access and immediacy, training, and education. Beyond service delivery, I've remained deeply engaged with the system-level work across the county. I served on the JDAI committee, focusing on alternatives to detention and supporting youth and families with less restrictive, more effective ways. I currently serve on the Community Corrections Board and JRAC Committee, and I am actively involved in the Mental Health Alliance for Howard County, working collaboratively to strengthen the local behavioral health system. I also sit on the IYI Community Engagement Team, as well as the IUK Advisory Board. It's meaningful to sit here today, not because 4C had to provide these services, but because we recognized the need and made a long-term commitment to the community. I continue to find great fulfillment in investing in Howard County, and it brings me genuine satisfaction to see how strongly we're still serving this community today. Today, any individual can walk into our office and start services immediately. When a crisis occurs within the community, our mobile crisis teams can be deployed to address that crisis. For individuals experiencing homelessness, our outreach teams are there to meet with them where they are, provide immediate resources and needs, as well as securing housing. And when organizations need training and education, we're ready to partner and respond. Thank you for your time and considering us as a designated community mental health center for Howard County. We value our partnership with the county commissioners and remain committed to meeting the needs of the community with accountability, collaboration, and care.
Thank you, Lisa. So Commissioners, I provided you a document that went through a lot of basic information. I won't go through every aspect of that this evening, other than just to kind of hit high levels and then be able to answer any questions that you might have. So as you are aware, Community Health Network has decided across all areas of the state to retire its Community Mental Health Center certification. So still a hospital, can still do all the things that a hospital does, may even decide here to continue to do some psychiatry therapist services, because they can do that all as a part of their hospital system. When it is that you retire a community mental health center certification, what you do, though, is you're saying essentially that I can choose the services for behavioral health I'm going to give, whereas a community mental health center has an array of services that it has to offer within a community. Today, because really we have seen ourselves as a community mental health center here in Howard County. We actually offer all of those services except for one, and I'm going to talk about that here in a little bit. And actually we offer services because we are the designated certified community behavioral health center here in Howard County that CMHCs do not offer, okay? Longer term, to continue that investment, we really need to be both. We need to be the certified community behavioral health center, and we need to be the CMHC. How this happens is when somebody retires their designation, the State Division of Mental Health and Addictions is the one who, along with FSSA, provides the designation, okay? Only an existing CMHC can become a designated certified community mental health center for another area that it isn't already designated for. And in the case of the current administration, in talking with the director of DMHA, she really wants to make sure too that when they're choosing new designees, that they're involving the local community, which is totally appropriate, right? Which is then what is it that the commissioners would recommend, right, to the division as far as that next community mental health center. So as Lisa mentioned to you before, we came here in 2015. That was at the time by the request of then commissioners, okay, and also community stakeholders. We opened up an office with a handful of staff. Today we have 83 staff that have a home location that is here in Howard County, and another 20 plus that spend partial time either overseeing or have some allotment here in Howard County. By and far, when you look at the 7 counties that we serve with full continuum services, Howard County is typically either number 2 or number 3 in terms of the total volume of numbers served. It certainly is right up there as number 1 or 2 in terms of the total staff that we have, okay? So I say that because this is a large enterprise for us, all right? You know what I mean? We have served, even before we had an office, from 2010 to 2014, we had already served over 3,300 Howard County residents. We didn't even have an office here, right? We've just had people who crossed the border probably, right, from either into Miami County or Cass County. From 2015 to 2022, and I'll explain why I have to do my counts this way, we served over 4,000 residents, so that was in our early years. We switched medical records, so now I'm going to jump back. There's a little overlap. From 2020 to current, we have served over 9,200 Howard County residents. Now, just in this last year, I provided you this information because I give you information annually. We have had about a little over 2,000 individuals that were served, about 50,000 services this last fiscal year for us provided here in Howard County. So we have all of the services already, as I mentioned, that are required for a community mental health system, except for group homes. So I'm going to talk a little bit about that. We have extensive partnerships in the community, both formal contracts, informal partnerships. We have a slew of staff that have been involved in all sorts of community meetings here locally, all of which I've delineated in the document that I provided to you. We have 2 major federal grants that Howard County particularly benefits from, mental health awareness and training, and then also our grants to benefit homeless individuals. That is, Howard County has by and far been the largest portion of that outreach for that federal grant. Now, in talking with community, they have they estimate about 300 individuals that may need to transfer over, okay, to the community mental health center. We could take those clients whether we're a community mental health center or not, okay? I want us to be the designated community mental health center because we have been committed for over 10 years and plan to stay committed, okay, to Howard County. So those folks are individuals that are adults with serious mental illness, right? So again, those folks who are presenting with mild or moderate issues, it's very possible that community may decide to continue to serve in some capacity. But it is the adults, the most vulnerable individuals, right, that they serve in their community support teams, in wraparound services, whether they're youth or adults, and then also within the scope of their group home and apartment living, okay, that they need to be able to transfer over because their continuum, once they let go of the CMHC certification, cannot support those particular individuals. So we have capacity today to start that, right? So I could say to community, hey, let's start transferring some of those patients. That could be happening, right? Like this is really about a transfer, an appropriate transfer into services with 4C. We would expect that over this next year to year and a half, because the process is lengthy. Once it gets to DMHA, the recommendation does, they have to go through a whole process, right? Then we have to go through a whole process with community and DMHA. So it won't happen like overnight, but I expect over the next maybe 12 to 18 months that we would probably be adding about 30 to 50 positions. Your question will be, well, can you even do that? The answer is yes. In the last, basically about 16 months, 4C has added across our continuum, many of those being Howard County, over 116 positions. So we are well positioned to add that workforce and to continue to build here in in Howard County. So let's talk about the group homes. So one of the things that, and we do this in Cass County, we have 2 group homes. We operated apartment living, those with tax credits before up in Logansport. So group homes, Community Day has Francis House, which is really a supervised group living. And then they have the Pillars, which is actually not a part of the Community Mental Health Center continuum. It is apartment living that is low-income house tax credit apartments for which their clients mostly live, right? So, that would be the same kind of approach that would be taken. They have a run-out period for those low-income house tax credit, that program, that doesn't necessarily have to be, renewed. Our intention would be to have that be longer term when that expired, what's called a transitional residential service. So up in Logansport, we have a supervised group living, which is for individuals who are presenting with most severe and need the most help 24/7. And the most supervision within their living experience. And then transitional residential are for those that kind of are a step up above that, who eventually could be living in apartment living, but they do need support, right? That's essentially how the Pillars operates mostly today. It's they have staff there, they're there most of the time. They don't have staff there in the evenings and weekends, but at our TRS, we staff it 24/7. We just feel like adults with serious mental illness require that level of some level of support around them. So in order for me to enter into what would be a due diligence with community on this front, I really would need that recommendation to go to DMHA, that you would be recommending us to be the CMHC. Why? Because as a CCBHC, group homes are not a requirement for us, okay? As a CMHC, group homes are a requirement. So in entering due diligence, what are the things that I'm a pretty frank person, so I'm just kind of laying it all out for you here, is those aren't hospital properties, okay? Low income tax credit housing, all right? The Pillars has some work, it needs investment, okay? It's fine, even community had said to me, we were just about to start investing. So, but the building requires, the apartment units require investment. SGL, that supervised the Francis home, what we call SGL, that is in a good, from a cosmetic perspective, we still have to get in there and look at all the bones, right, of both of those buildings. And I would simply say that it is my understanding from the communications given to me that community would probably want us to purchase those things, okay? So that's a part as opposed to just handing them over to us, right, to operate. If they were handing it over to us to operate, this would be a no-brainer. We've done this. We know how to do it. We have the staff to do it. But if they want us to purchase us, it can't be it's not a hospital property, right? So they have a real estate department, and so, you know what I mean? I have to be very aware of, right, that they are requesting prices that are reasonable for a nonprofit, non-hospital entity, and that those are not hospital market prices, right? So that's probably the biggest part of the due diligence process that we would have to go through with them. Again, operating those kinds of things, it's just, I'm not saying it's a no-brainer. It's just that's what we do as a community mental health. We already have experience with this. We know how to manage those things. We already serve many, many adults with serious mental illness here in this community. And so the other thing that could come up is, and I don't know that it's possible, I think Commissioner Dodd asked me about this, is it possible that there could be some other CMHC, right, that might come and say, hey, you know what I mean, we might want to be that. You could, right? Somebody could come to you. And I've said this, and I said the same thing to the Tipton commissioners who did approve for 4C to become the next community mental health center in Tipton County, is any one of those community mental health centers, even if they've done some services in Howard County, they've chosen to do a sprinkling of services over a decade that 4C, we all had the same opportunity. Not one of us were any different. But we took the opportunity to continuously invest. And I feel like that sets 4C apart. We didn't have to. We saw a need, and we did. And all of those other mental health centers had that equal opportunity to do so too, right? And so I feel like that sets us apart in this way. I definitely have never overpromised and underdelivered as a CEO. I've come here every year to talk to you guys when it is that's not even required of me, because we see ourselves as a part of this community connected to what's happening. So that is kind of where we're at in a nutshell. So I'm gonna zip it, lock it, and put it in my pocket, and please ask any questions that you want of me.
Well, I got 6 of them.
Okay, go for it.
The Pillars that you're talking about?
Yeah,
Behind Indiana Health Center?
yes,
Okay.
yes.
Okay, that's first, okay, I'm familiar with that. If a person come in and you had to do inpatient, how does that work?
So two things. One, we already have established MOUs with inpatient hospitals, but I did specifically talk with George Hurd about developing an MOU so that they could get accessibility. If we had somebody who needed inpatient, that we would have an MOU that might happen with communities still. And then the same thing is, you know, there is another psychiatric inpatient unit in town, and that's through St. Vincent's. And so certainly we would pursue that also.
And then, do you guys have a med clinic?
We do. So here today in Howard County, we have psychiatric medication clinic services. We have outpatient therapy. We have peer services. Embedded within both of those is their mental health and addiction-related services. We have groups. We have our embedded school-based services. We have community-based services, so folks going out into the home, working with DCS, right? And we also have and are involved with referrals with criminal justice. We do some jail groups, I believe. Our peers do. And then in addition to that, we have our assertive community treatment teams. That is an evidence-based practice for adults with SMI. You guys are familiar, that wrap services around folks and are available 24/7, 365. We have our mobile crisis teams also. That's another thing I spoke with community about, George specifically, that, you know, we could even provide our mobile teams, you know what I mean, could be responding to the local ERs the same way that we respond to the local ERs in every other community that we're in.
And then, so if you become the community mental health provider, does that open you up to be able to collect the tax levy that's collected and?
It does, it does. And so Commissioner Lipinski, let me tell you a little bit about how we do that today. So because we are a certified community behavioral health center, and that is a 4-year pilot, okay, likely to have a runway past that, during this period that we are doing certified community behavioral health, because we are paid differently, okay, than a community mental health center. I think you would hear from Georgia Community like we are just better resourced, okay, than a community mental health center is because we're a CCBHC. What that has allowed us to do in every other community is I have not collected any 2025 mental health tax levy because we don't have a place for that to go in our system, okay? Now, what I would say here in Howard County is I would like to be able to offer that same thing. I have to be honest with you, that is predicated on what happens with these two facilities, right? The Pillars and the group home, because there is no funding for those whatsoever, just the services you provide. And so that really would be a part of, you know what I mean, what we're looking at when I'm looking at kind of what ends up happening with both of those locations.
And then my last question would be, we took opioid funds in the past and we partnered with you guys
Yeah.
for the homeless population. So do you have numbers on that or not today? That's fine if you don't.
Well,
And-
actually,
and-
there is numbers in the
I
document.
couldn't find.
There,
there's
it's
so many pages. I
so many
missed.
pages, yeah.
And then, on that regard, is it better than it was, or have we made improvements there? Because,
Sure.
I think during the fall, we had an uptick in homeless people in Kokomo, and for whatever reason, and, obviously with it being so cold, I hope they have a place to go, but, we did see an uptick this fall, and maybe it's, is it in regards that we're building a new rescue mission? I don't know, but there was an uptick in homelessness.
Yeah, so homelessness is always going to be a challenging issue because you can't make somebody not be homeless. You can only encourage them to get involved. So we have outreached and been involved with 238 individuals in 2025 just here in Howard County. That is humongous. I mean, by comparison, I think it's like maybe around 70 for Cass, a little bit less for Miami County. That's where we have our homeless outreach services. So and I don't even think we've probably touched the top of the cherry, right, in terms of the number of people that could be contacted. So when we contact folks, what happens is we outreach them a minimum of twice. We try to enroll them for anything that might be eligible relative to housing, that might be an opportunity for them. In addition to that, we seek to make sure that they have backpacks, like, you know what I mean, if they need some kind of a supply that's necessary in order to be okay and be safe. We try to connect them to services also, right? So they can be homeless and still receive services at 4C. And so what we'll do is since we've just finished 2025, the director who oversees that program does have some like 2025 numbers that are a bit more specific. So for that particular program, I'll just reach out and get back on the docket and have her present so you can get a little bit more in that
Good
area.
information, thank you.
So, Dr. Caldwell, does four counties still have their inpatient unit up at Logansport?
No, we do not. So what we did is because, Commissioner Dodd, when you add mobile crisis teams, okay, and you have a crisis stabilization unit, so today in Peru, we have what we call a crisis stabilization unit. Embedded in that crisis stabilization unit is a psychiatric urgent care, okay? We then have also what we would call our high acuity space and beds, and that's where it is that folks, I call it's probably more like a behavioral health ER, okay, 24-hour triage. And then we have an area that has beds that's called subacute, and it's for people who need voluntary kind of longer stays, right? It's also a location where folks who are our adult clients with serious mental illness, if they are starting to have difficulty, they can stay there in order to avoid an inpatient psychiatric stay. So we started some of these crisis services back in 2020, 2021. And so what happened over time is actually we got really good at keeping people out of the hospital. Like we didn't even have much of a census anymore to have an inpatient psychiatric hospital because we've gotten so good at keeping people where they need to be in the community and avoiding those hospitalizations. So we decided to further invest in those basic crisis units, right, as a part of our overall model. And then we have relationships with a couple of different inpatient units, like I mentioned, if somebody needs it. Our goal as a CMHC, but most importantly as a certified community behavioral health center, is if they need that level of care, our mobile teams and anybody who's touching that person, right, engaging them, they need to seek and find that for them. However, 60 to 65% of the people who we respond to with mobile crisis, we stabilize in the community. Another 20 to 25 if they go to our crisis unit. We can take EDOs actually in our crisis unit too, by the way. So, it's it's not inpatient, it's kind of sits in between, right? You know what I mean? Then, those folks are able to return to the community. So it's only a small percentage of people today that 4C actually needs to have go to an inpatient unit.
If you were designated as our community mental health center, would Howard County residents be eligible for those units?
Yeah, and it really, not probably in year one, okay, but like Howard County is a place, so if I think about where we were in 2015 and where we are today, right, you know what I mean? First thing, we'd have to get through this whole group home thing, right, you know what I mean? That's priority number one. Number two then becomes then, I believe here, and we've talked about this before, we can open a clubhouse, right? So that has to be then on the horizon. And then the third component is Howard County is definitely a place where that entire, parts of those models that we have even in Miami County are really possible here, right? You know what I mean? In Miami County, law enforcement go and they just drop the person off at our crisis unit, and that's it. Like, we take care of everything else. And so, it's something that, I think that here, and we go to the ERs in our local counties. You know what I mean? I just think that if we're the community mental health center, it just changes the nature of the partnerships, right, with the local hospitals that we have. And then in addition, that longer term, there's an opportunity to think about how those types of crisis units make their way here too, because I know that the need is here.
I've heard a rumor that community will be closing their inpatient unit and moving it. So that's why I asked that question. What will happen to our Howard County residents if they'd be eligible to use these units?
Sure, well, two things, if that was true, okay, which I certainly cannot, say what their plans are. We have operated in extremely rural areas, deploying mobile teams all the time, okay? Number one, I think there's an opportunity, there probably are some people who end up in inpatient hospitalization that don't have to, all right? That if mobile was used more often, right, we could divert in that way. Number two, ultimately, if they land in the ER still, okay? Because community has an ER, St. Vincent's has the ER, then we can deploy there. And then really our mobile teams, in working with law enforcement in every other county, like we do actually transport a lot of those folks where they need to go, okay? So let's say, I've seen the press releases, community does have a partnership with a national inpatient psychiatric hospital network. So they're gonna have hospitals somewhere, okay, you know what I mean, and probably in more than one place. We're still gonna look at how do we partner with them, right? You know what I mean? If it's here, if it's somewhere else. And then there are all sorts of inpatient units that surround us, right? And so, today, if somebody needs inpatient and they are in Miami County, then sometimes our teams have to take them up to Plymouth, right? Sometimes they have to take them down to Howard County, right, to St. Vincent's or other places. I guess when you've worked and operated in rural areas for so long, going the distance doesn't seem like such a big deal. You travel 30 minutes, 45 minutes to get somewhere they need to be. That's just what you do, yeah.
I kind of fibbed because I didn't have any more questions, but now I have one. How many, and you may or may not know this answer, how many long-term mental health beds are there in the state of Indiana that were you ran by the state of Indiana?
Oh, like the state psychiatric hospitals? Oh, man, I think that I was just literally listening to a presentation on Friday, the FSSA quarterly financial report. And I think they have somewhere plus or minus around 750 beds. It's somewhere around there. However, one of the things that is, they are mostly dealing with forensic patients at this point. And so, the wait can be up to 90 days in order for somebody to get long-term placement like that. So the goal really has to be to figure out how to manage folks, right, in the community. I don't foresee the state adding state psychiatric
I
hospital
don't either.
beds.
I don't
Yeah,
either.
yeah.
Thank you. Thank you. Very good information.
I've said this, I'm saying it more often now, but while it may not be the best, our biggest mental health facility still remains our jail. It's not the best, but it is the biggest right now. So unfortunately. Brad, any questions?
Guys answer all.
Anything else you'd like to add?
No, other than I just would like to understand next steps, you know what I mean? If you were willing to approve a motion tonight, then what happens is that just goes to DMHA, right? And then DMHA starts whatever wheels they are doing. And if that motion was today, then I can pick up the phone tomorrow to George and start a due diligence process on those properties.
Yeah, Alan, I think we'd have to draft communication with the state.
Yes.
That we are recommending this. So I think that's the next step. Now, I don't know what next step on your part is, but
So are you doing a motion tonight to recommend?
well, that's what I'm going to ask my
Okay,
fellow
okay,
commissioners. if
Yeah,
they have any other questions.
Sorry.
I think it would be remiss if we didn't, so I will make that motion.
I'll second it.
So I have a motion, and I have a second. All in favor?
Aye.
So that motion is passed.
Okay, I will connect you with the powers that be specifically by email at the division, so that you have that contact information. And then I will be contacting George Hurd, I'll text him tonight, okay? And then I will plan to follow up and come back with some additional information on where we're at, and probably provide that by email too.
Let me just say how much I've appreciated working with you, Lisa, Four County staff, what you've done with with our sheriff's department, our local police department, on those emergency contacts, I'll call them. I know I've heard from police officers how successful that's been and how much they've appreciated it. And I do believe, while I may not have the numbers, I do believe it has benefited our community. So how much we really appreciate the effort you guys have put forth.
Well, I appreciate it, and we see this as an opportunity, and we don't squander opportunities. So we expect to have more happening here in Howard County, and we will also ensure that we have more in the criminal justice range happening within the
And I
next year.
appreciate you going out to the Francis House and to the apartments and taking a first hands-on look at those and understanding what resources we really do have. And those are great resources that we have here in our community. So I appreciate that.
Thank you.
Okay, thank you very much, thank you.
Okay, next up will be Madam Auditor Jessica Sechrist.
This is our 2025 100R. This is the compensation of each employee during 2025. It's advertised in the paper, and it will be posted in every building that we own.
So we just need to mark this as received, approved, what?
Just received.
Okay. So we will mark this as received by the commissioners. I suppose you want it back.
Sure.
Thank you, Jessica. That takes us into claims and reports. Salary claims.
$1,148,727.91.
Motion approved as presented.
Second.
I have a motion and a second. All in favor?
Aye.
Those are approved. Payroll expense.
$1,148,727.91.
Motion approved.
Second.
I have a motion and a second. All in favor?
Aye.
Those are approved.
What's going on here? Somebody's down in the hallway.
Somebody pass out? Oh, yeah, there's somebody down.